We are seeing numbers that none of us believe it was possible to see with this pandemic right now.
It's never been this bad, and it's only getting worse. A nation in the midst of a full-blown crisis. The U.S. setting records for new coronavirus cases, hospitalizations, and deaths Thursday. COVID-19 becoming the leading cause of death in the U.S. this week, according to researchers at the University of Washington, whose influential model now predicts the death toll will nearly double to almost 539,000 people by April 1st. That's more people than live in Atlanta, in Sacramento, or in Kansas City, Missouri. Experts warning there is more trouble ahead.
So I think we have not yet seen the post-Thanksgiving peak.
That peak could come in the next couple of weeks, putting more pressure on already struggling hospitals and 911 systems.
What lies ahead for the next few months? It's actually our worst case scenario in terms of overwhelmed hospitals, in terms of the death count that is occurring.
Ohio's governor warning the state's hospitals are already in crisis. California, which hit another single-day high for new cases Thursday, pulling the emergency brake with new restrictions tied to hospital capacity.
The bottom line is if we don't act now, our hospital system will be overwhelmed. If we don't act now, we'll continue to see a death rate climb, more lives lost.
With hospitals in the Golden State treating a record number of COVID patients in the ICU, the new stay-at-home orders will go into effect 48 hours after a region's ICU units fall below 15% capacity. 4 out of 5 regions expected to reach that threshold quickly. The lockdown on the Navajo Nation, which was set to expire in days, will now be extended for another 3 weeks. And a stay-at-home advisory in Delaware kicks in December 14th. Meanwhile, states are preparing to distribute thousands of doses of a coronavirus vaccine as soon as possible after the FDA signs off, which could happen in the next couple of weeks. New York expects to receive 170,000 doses on December 15th.
The next chapter is going to be vaccine distribution and vaccine acceptance. This is the weapon that wins the COVID war.
But officials everywhere say distribution will be a challenge.
They're going to fly in these vaccines and leave them here in our state, and we're going to be responsible for getting it to people. It's going to be complicated logistically.